Dr. Welke, tell us a little bit about the Sim Lab and how the experience has been from a faculty perspective in using the Sim Lab throughout the curriculum.
With the WAUSM curriculum, we have two courses. We have Foundations of Medicine and then Patient-Centered Care. And so you have two courses in our term, which is 15 weeks. So the Foundations of Medicine is what we've been talking about, like the in-classroom cases and questions and dissecting things and all of that. The Patient-Centered Care runs with the Foundations of Medicine, and they're aligned. So I'm just going to use second semester as an example because Carly's in there. Right now, they're in the cardiovascular unit. So they may be in classroom learning about what you do, hypertension or cardiac arrest or whatever it may be. And then when they have their patient-centered care activity that week, they may be doing heart sounds. So it all aligns. What they're doing in Foundations of Medicine aligns with what they're doing in the clinical skills environment. Anthony mentioned the Sim Lab. We see a video going here. So they will be practicing the skills related to whatever unit we're doing. That could be cardiovascular, respiratory, gastrointestinal, reproductive, and so on. So you see a lot of the activity going on in the video. We are really blessed to have 4 simulation bays, and we have 2 types of simulators. So 4 of these simulators in total, and then we have what we call task trainers also. So we have heart sound. There we have a mat that's called a mat task trainer that does heart sounds, respiratory, and bowel sounds. And we have our Harvey task trainer that does heart sounds. So whatever foundational sciences, the basic sciences you're learning, then we apply in this simulated environment. And students really get this hands-on experience, as you see, in practicing those clinical skills. There, what you see now is the Harvey heart sounds, and you see all the students get sort of a receiver, and they can work through this. What's awesome about our clinical suite, which we're sitting in right now, is students can have access to this. They can sign up and come in and utilize different areas for practice. So that's really a nice feature of that. So I think this is really progressive. Not all schools have all of this the technology that we have for the clinical skills learning and environment.